My name is Georgian Palisop and this is assessing the thorax. So first, review client's previous medical records and doctor's order sheet if available. Second, determine the scope of assessment needed. Prepare necessary equipment. Third, perform hand washing. Don gloves if deemed necessary. Fourth, greet the client politely. Introduce yourself and verify the client's identity. Ask how the client would like to be called during the assessment. Establish rapport with the client. Fifth, explain the procedure to the client and how he or she can participate during assessment. 6. Ensure client's comfort, privacy, and confidentiality. Assessment setting was assured to be safe, secured, and free from distractions. So, good morning po sir. Ikaw po ba si Glivia Napaliso?
Yes po.
Ano pong gusto niyo tawagin sa inyo po sir?
Glove na lang po.
So, Glev, ang gagawin po ating assessment kami is assessing of thorax. Lahat po ng data na makuha namin is confidential, meaning wala po makalam kundi tayo lang po dito sir. Thank you po sir. Number 7, surveying the chest and respiration. Check for signs of respiratory distress or problems with oxygenation. Observe colored face, lips, chest, and fingernails. Number 8, palpate supraintestinal notch and noted the position of the trachea. Palpate. Inspected configuration. Number 9. While the client stands with arms at the side, stood behind the client, and observe the position of scapulae in the shape and configuration of the chest wall. Number 10. From a lateral position, observe the 3 normal curvatures, cervical, thoracic, and lumbar. Number 11. To assess for lateral deviation of spine or scoliosis, observe the standing client from the rear. Have the client bend forward of the waist and observe from behind. Sir, likod po tayo. Check natin kung align po ang likod niyo. Hindi. Thank you po, sir. Number 12. Assess the temperature integrity of all chest skin. 13. Palpate all thorax areas for bulges, tenderness, or abnormal movements, especially for clients of respiratory complaints. So, check po natin ang temperature ng chest skin mo. Sunod, ipalpate natin ang thorax. Thank you po, sir. Number 14. Place the palms of both your hands over the lower thorax with your thumbs adjacent to the spine and your fingers stretched laterally. Ask the client to take a deep breath while you observe the movement of your hands and any lag in the movement. So, check natin ulit ang lower thorax nyo kung may abnormalities po. Take a deep breath, sir. Thank you po, sir. Number 16, place the palmar surface of your fingertips or the ulnar aspect of your hand or closed fist on the posterior thorax, starting near the apex of the lungs. Number 17, ask the client to repeat such words as blue moon or 1, 2, 3. Number 18, repeat the 2 steps, moving your hands sequentially to the base of the lungs. Start toward the midline at the level of the left scapula. And move your hand to right, comparing findings bilaterally. Move symmetrically downward and out to cover the lateral portions of the lungs at the bones. 19. Compare the firmitudes on both lungs and between the apex and the bone base of each lung, using either one hand and moving it from one side of the client to the corresponding area. On the other side, on using 2 hands that are placed simultaneously on the corresponding areas of each side of the thorax. Sir, sabi po kayong blue moon kung sabihin ko po mag-blue. Sige po, sir.
Blue moon. Blue moon.
Sige po, sir.
Blue moon.
Sige po, sir.
Blue moon.
Sige po, sir. Number 20. Ask the client to bend the head and fold the arms forward across the chest. Number 21. Percuss in the intercostal space of about 5 centimeters or 2 inches intervals in a systematic sequence. Number 22. Compare one side of the lung with the other. Number 23. Percuss the lateral thorax every few inches, staring at the axilla and working down to the 8th rib. Sir, bend po natin ang head natin. Tapos i-fold po natin ang arms. Tapos percuss ka lang po. Kabila lang po, sir. Sige po, sir. Number 24. Use percussion to identify the level of the diaphragm and measure diaphragmatic exertion. Percuss downwards from above the expected level of diaphragmatic dullness until dullness is definitely heard. Mark the level of full expiration. Number 26. Had the patient inhale deeply and hold it in. Then percuss downward to the level of dullness and full inspiration and mark it. Number 27. Repeat the process on the other side. Measure the distance between the expiratory and inspiratory levels of dullness. Sir, mag-percuss po tayo ng diaphragm. So, hinga po tayo na malalim. Kabila naman, sir. Thank you po, sir. Hinga na po kayo. Number 28. Place a diaphragm of the stethoscope firmly and directly on the posterior chest wall at the apex of the lung at C7. 29. Ask the client to breathe deeply through the mouth for each area of auscultation. 30. Using systematic Latin pattern used in percussion, listen at each point of the breath sounds during a complete inspiration and expiration. Number 31. Compared findings of each point with the corresponding point on the opposite side of the thorax. Note the location of the chest wall where the adventitious sounds are heard as well. Sir, inhale po kayo pag sabihin ko at exhale pag sabihin. Inhale po, sir. Exhale. Inhale po, sir. Exhale. Inhale, sir. Exhale. Inhale, sir. Exhale. Inhale, sir. Exhale. Inhale, sir. Exhale. Thank you, sir. Number 35. Inspect breathing patterns. Number 36. Inspect the costal range at which the ribs enter the spine. Sir, inhale po tayo. Tapos exhale. Thank you po, sir. Number 37. Using your fingers to palpate for tenderness and sensation. Start palpating with your hand position over to the left clavicle. 38. Move your hand systematically downward and toward the midline at the level of the breast and outward of the base to include the lateral aspect. 39. Repeat the sequence in palpating for crepitus and fremitus in the arterial. Number 40. Place the palms of both your hands on the lower thorax with your fingers laterally along with the lower rib cage and your thumbs along the costal margins. 41. Ask the client to take a deep breath while you observe the movement of your hands. So, check po natin ang chest nyo. Tapos check po natin ang lower rib cage. Inhale po, sir. Tapos exhale. Thank you po, sir. Begin percussing above the clavicles in the supraclavicular space and proceed downward to the diaphragm. Compare the lung on one side of the lung and the other side. Displace female breast to facilitate percussion of the lungs. Sir, percuss pa natin ang lower rib cage nyo. Kabila po, sir. Thank you po, sir. Auscultate the anterior thorax. Next, place a diaphragm of the stethoscope firmly and directly on the anterior chest wall. Next, auscultate from the apex of the lungs, slightly above the clavicles to the base of the lungs, at the sixth rib. Next, ask the client to breathe deeply through the mouth in an effort to avoid transmission of sounds that may occur with nasal breathing. Next, listen at each side for at least one complete respiratory cycle. Sir, inhale po tayo. Exhale po. Inhale po tayo, sir. Exhale. Inhale po tayo, sir. Exhale. Inhale po tayo, sir. Exhale. Thank you po, sir. Number 48, summarize the information obtained during the working phase and discuss findings to the client. Next, assess the client understanding of the plan and the need for further teaching. Number 50, thank the client, ended the interview politely. And last, document findings in the client using printed elective forms or checklist. So sir, after assessing your thorax, wala po kami na-detect na abnormalities or any disease na nangyari sa inyo. So, kung may tanong po kayo sir, sabihin niyo lang po kami. And thank you po sa time.